In this video, I'll go over a recent and ongoing case study of someone that came to see me with knee pain. If you have knee pain, you might derive some useful info from this video, but I always recommend you get detailed assessment to get an individualized treatment plan and exercise protocol to address your problem. Every case needs to be addressed individually. So many different factors involved, length of time leading up to the injury, different muscles involved, different deficiencies in the body that might contribute to the chronic pain. So get individually assessed, but let's dive into my specific case study. The client came to see me about a month and a half ago, pain in both of his knees, pain when squatting, getting up off a chair, going downstairs, basically every time he bent his knees, pain in both of his knees. Upon further inspection, swelling in his knees, pain all around his knees when applying pressure around his knees and on the knees. So right there, I have to send him to a doctor to get imaging, or to ask for imaging at least. We need to find the extent of the damage, or see what the extent of the damage is to the joint or bones involved in the knee, to the patella, to the tibia, femur, see what's going on there. Although we need imaging, we can still do plenty to assess the client as it stands. So he's here already. We need to assess and see if there's some kind of treatment we can do to alleviate the symptoms that he has. So upon further inspection, we're testing and palpating the different muscles that surround the knee. So with palpation, we find that the vastus lateralis on both sides, so muscle in the quad, is tight, hypertonic, and has trigger points. Now, I'll make another video about trigger points. Some people dispute or don't really know what a trigger point is. Before I became a registered massage therapist, I didn't really know what it was. Sometimes it sounds hokey to people, like it's not a real thing. Does it really have any basis in science? It does. I have plenty of experience treating and feeling trigger points and alleviating those trigger points, getting rid of them, smoothing them out, and getting people free of pain. So it is a real thing. Let's move on. Trigger points in his vastus lateralis, causing pain, referring pain down into his knee. He has it more on his left side than the right side, but either way, they exist in both sides. He has also very tight calves with multiple trigger points in his gastrocs and soleus muscles. He has weak and tight hamstrings, very tight quads and hip flexors that limit his range of motion in hip extension, and because of that, he also has weak glutes. So we're getting a picture of what's going on here. In terms of movement, when he's squatting, he's always squatting knee dominant. So he's on his toes, his calves are so tight that he can't get his heels down to the floor. His squat is very restricted. So he's very quad dominant in his movement. So those quads are taking a lot of load. They're already very tight, so the muscle is not functioning as it properly should. In order for muscles to properly function, you need to get them moving in their full range of motion, get that circulation in there. Commonly, dysfunction happens just from things being too tight or overused, and an imbalance happening on the sides of the joint. So one side of the joint is working more than the other side is underused, either overstretched or very tight. And in this case, the quads, so the front of the thigh, is doing much more work than the back of the thigh. Back of the thigh, his hamstrings, his glutes, very weak, tight in the hamstrings. Front of the quads are very tight. He has strain in the front of his quads, the vastus lateralis specifically, which has a lateral pull when it's very tight on the kneecap and can create patellar maltracking. Another sign of patellar maltracking that we found in assessment is Clark's sign, or the patellar grind test. So this is a test that's used to indicate or confirm patellar maltracking, also called patellofemoral dysfunction, and his patellar grind test was positive. So we have multiple elements now painting the picture of what's going on surrounding his knees. Very tight vastus lateralis, which is a common muscle involved in creating patellar maltracking or causing it. This client has had knee pain for years before it got to the point where it's so painful that he's trying to get it addressed. So going to see different therapists and doctors to see what's going on with his knees. So we can see that it's a chronic issue that built up over time. So you have the movement patterns that contribute to it. Knee dominant, very knee dominant, not using the rest of his hips. So for example, glutes, hamstrings, in the way he's moving. His ankles are very tight, which limits his ability to squat leading with his hips. So everything's leading with his knees, a lot of pressure into the knees, and also maltracking of the knees. So it's a recipe for damage happening to the patella. So after this assessment, we create a treatment program or a treatment plan. In the first treatment, I treat his vastus lateralis to iron out those trigger points and alleviate that tension in his quads. I give him a nice stretch in the quads to help lengthen that muscle and just help it relax so there's not so much tension there. I also treat his trigger points in the calves, and we get a very deep assisted calf stretch after the trigger point treatment. So after I get him off the table, that first treatment, he's completely pain-free. Squatting, no pain. Bending his knees, no pain, saying he hasn't felt like that in a very long time. A week later, he comes in for a second treatment, and I ask him, so how long did that treatment last in terms of the relief that you felt? A couple days. And then progressively the pain started to return. So I gave him a second treatment, same results. And after the second treatment, he was able to get x-ray results. So comes in for the third treatment, we have x-ray results, and it shows mild arthritis in the knees. By the third treatment, when he comes to see me a month later after the first treatment, we took a couple weeks break. I was on vacation, came back, and I saw him. He has no swelling in the knees anymore. So those couple treatments alone alleviated, or at least allowed his body enough time to recover, and at least the swelling was gone. Still had pain in the knees, but no swelling, which was great. That's progress. Now that we know and have a picture of what's going on in the knee in terms of damage, with mild arthritis, we can move forward in terms of treatment plan and now prescribing some home exercises for him to do to help alleviate these symptoms in the long term. Because treatment alone, if we alleviate his symptoms for a couple of days at a time, we don't want him coming back every week and just giving him a quick fix. We want to make sure that he improves his quality of movement and he gets certain muscles stronger to help that balance around the knee joint. So we get another treatment, again, pain-free after the third treatment, squatting, moving around without pain. And these are the exercises I prescribed specifically for him. So first, to address the hamstrings and the back of his legs. So very tight in the hamstrings, also weak in the hamstrings. And you can have both. Sometimes people are tight and strong in the hamstrings because they use them a lot, sprinters, for example. Other people, my client here, for example, is tight and weak in the hamstrings. So we need to strengthen the hamstrings and we need to lengthen the hamstrings in order for them to get full range of motion, contracting and relaxing properly. So I have him do hamstring walkouts as one of his exercises in his home exercise program. And I have him do a hamstring stretch up against the wall to help lengthen and relax his hamstrings to get better range of motion through his hamstrings when he's exercising and moving around. Next, we address the front of the thighs, the quads, the hip flexors. We need to get improved range of motion there. They're very tight. They need to be lengthened, relaxed, stretched out, so he's getting proper contract, relax in his quads. Couch stretch is one of the most effective stretches for the quads. You can really get deep in there. So couch stretch is part of his program. And in terms of activating the backside of his hips, we're going to get him to do alternating hip thrust kickouts. One of my favorite exercises to get the back of the hips, the glutes, hamstrings working, specifically the glutes. So you get on a bench and you're alternating kickouts and you're making sure you're staying up as high as possible. So after you do the couch stretch to get some extra range of motion through your hips to improve or allow you to get better hip extension, then you go into that hip thrust alternating kickouts, getting full extension, really driving the hips up high, and alternating kickouts. You're activating one side at a time, activating your core, trying not to rotate your body while you're doing those kickouts, but stay in a nice tabletop position, keeping active in the glutes and core. And then we address the calves. The calves were a surprisingly big element in terms of alleviating the symptoms that he had in his knees. Whenever we got into those calves, got a deep treatment and stretch, he felt even better than just having the treatment on his quads, that vastus lateralis muscle. So for the calves, I recommend he do self-massage every 3 to 4 days with a lacrosse ball on the back of his calves, just to get some blood flow, move that tissue around, and then get into a deep dynamic stretch daily for his calves. So those 6 exercises, but main 3 elements that we're looking for: alleviating tension in the quads, activating some of those muscles that are weak and less active. And then, as a general principle, aside from those 6 exercises I'm giving him as homework to do daily, one of them is not daily, the lacrosse ball for the calves, something to do every 3 to 4 days. You don't want to be bruising the calves and massaging them out every single day. Aside from those exercises I gave him, we're going to give him some general principles to follow to take pressure away from his kneecaps. So some of the movements, for example, that he can do pain-free, even when he comes in for the treatment when he's already in pain and not after the treatment when he's free of pain, is assisted squats. So this allows you to squat and sit back into the squat versus being very knee dominant and getting the knees forward in front of the toes, for example. Not to say that getting your knee in front of the toe is a bad thing. You should be able to do that. But in his specific situation, we want to first give him the environment, give his knees the environment to recover, give it the opportunity to recover. And in this case, we don't want to avoid things that create pain and things that he's already done too much of that have contributed to his pain. So rather than squatting forward, we're going to have him hold on to something, let him lead with his hips, sit back further so that his knees can get full range of motion, pain-free in that assisted squat. So that's daily general practice for him. Also, side lunges, assisted side lunges. We're getting him moving side to side, laterally, to work the lateral aspect of his hips, getting some of those glutes and stabilizers working side to side in his hips. And another general principle, as he's moving around throughout the day, I'm going to have him lead with his hips when he's going to sit down, for example. So rather than just bending his knees and going straight down with his knees coming forward, we're going to have his hips come back so that his knees stay in line or above the ankles, and he's getting more of a balanced pressure through his knee versus a forward pressure that puts a lot into the patella. When he's lunging, for example, lunging to tie his shoes, rather than squatting down with his knees coming forward above his toe or in front of his toes, I'm going to have him do a reverse lunge to tie his shoe so that his tibia stays in line, straight vertical to the ceiling, and he has a 90-degree angle at his knee, and he can do that pain-free. So it allows his knees to recover. So there are many elements involved in treating knee pain. There's the treatment side of things. So discovering what things need to be treated, what is dysfunctional when you test out the muscles, when you palpate the muscles. And there's the exercise component, making sure we're activating and strengthening some of the deficient muscles that surround the joint, and we're lengthening, relaxing some of the muscles that are very tight. And when you get that better balance around the joint, it tends to go a long way in terms of allowing that joint to work properly, having muscle balance surrounding that joint, and also giving the person better ways of moving. So teaching and coaching them about movement patterns so that the body moves in a way that is not injurious to the joint. So I've seen him 3 times so far. Just saw him a couple days ago for the 3rd time. Gave him this exercise protocol, and I'm going to see him next week and see how things are progressing.